Welcome to Fertility Village. This is your weekly live talk show where community and support come together. With rotating hosts, expert guests, and meaningful conversations, we're here to guide you through the highs and the lows of infertility. Whether you're searching for answers, seeking advice, or just looking for a special place to belong, Fertility Village is your space to connect, learn, and grow. Because it really does take a village, and we are here for you every step of the way. Thanks for joining. Welcome to Fertility Village, everybody. Hello. We're live at Oasis FSN tonight at Fertility Village. My name's Erin.
And I'm Marissa, and we're so excited to have everyone join us for another important conversation. If you're new here, Fertility Village Live is all about bringing experts, real stories, and community support to those navigating infertility and reproductive health challenges.
So before we dive in tonight, we want to just remind you all that you can connect with an incredible support system through the Oasis Fertility Support Network on Facebook, Instagram, and at oasisfsn.com. And if you love these conversations, then you can listen to all the episodes in audio format on the Oasis Fertility Podcast, anywhere you get your podcasts. And don't forget our fertility party is coming up on June 22nd. You can get tickets on oasisfsn.com or find the link in our bio on Instagram. But we would love to see you there. It's for the fertility community. It's a totally fertility safe event. So if you're currently in the thick of it, don't worry, no triggers. It's going to be just the best day ever. We're going to all wear a hat. There's a prize for the best hat. So everybody needs to come.
That's right. Okay. Well, let's get into our topic tonight. So tonight we're going to talk about a condition that affects millions of people around the world. Endometriosis. We know how frustrating, painful, and misunderstood this condition can be, especially when it comes to fertility. So we've compiled an amazing panel of endo warriors who will be sharing their personal experiences, their insights, their advice, and we're just so grateful that you guys are here and willing to share with us. So thank you for coming.
Yes, thank you for being here. So we just want to get the episode started by just getting to know each of you. So we're asking each of our panelists to introduce yourself and share a bit about your endometriosis journey. Leah, why don't we start with you? I know you're involved with Endometriosis Event. It's a nonprofit organization here in Canada. So why don't you start by kicking it off and tell us a little bit more about yourself?
Okay, thank you so much. First, I wanted to say thanks for this opportunity, and I think it's such an important conversation. So I'm very grateful to be here tonight, and hopefully your audience gets something out of this conversation. So my name is Leah, and I am co-founder of the charity Endometriosis Events, also known as Endo Events. We raise awareness of endometriosis through facilitating a support group. We host events, we do educational workshops, and we also advocate politically. So recently we did have a petition which was tabled in legislature last March, or last fall actually, after we did start the petition signing in March. And we got a lot of signatures and a lot of conversations around that. So we just basically want to have a safe space for individuals who are dealing with either suspected or diagnosed endometriosis to have conversations and to feel that they can network with other people who are dealing with similar journeys. And we always say not all journeys are exactly the same. So we also just recognize that that's something important that people know when they do connect with us.
That's amazing. And tell us about you. Tell us about, a little bit about yourself.
Yeah, so my journey with endometriosis started quite a long time ago. So I did get my period when I was quite young, and on onset, I had horrible cramps and a lot of pain, and a lot of the symptoms that we do talk about often, including back pain, nausea, different issues like that. And it actually took over 20 years for me to get an official diagnosis, which is something a lot of endo warriors can echo in their journeys. Unfortunately, it does take a long time to get diagnosed. And so that's one of the reasons I did chat a little bit about what Endo Events does, because if there was something similar when I was going through the diagnosis period and just all the, pain and discomfort I had prior to that, I think it would have been beneficial and definitely something that could have helped me along just to get information, advice, hear from people, and know some of the things that were available to help me along the way. So that's a little bit about my journey, which I'll delve into more throughout the podcast. Thanks.
Amazing. Yes, thank you for sharing all of that. That's awesome. Why don't we move on to Taylor next?
Hey guys, I'm Taylor. I am a nurse in my own personal life. Started off my nursing journey fairly early in fertility, and the reason why I chose to kind of go that direction was my journey with endometriosis. Hearing Leah's story, it's like so obvious how different everybody's stories is. So I actually got my period quite late, kind of in that grade, like late grade 10, early grade 11. So I was quite a lot older than a lot of girls that get their period. And it came in fierce and intense. First day I had my period, I blacked out the bathroom, which was super fun. And then experienced what most endo patients experience, saw my family doctor and was told I'm just one of those unfortunate girls that has really bad periods. And while it didn't take me 20 years, it took me over 10 years to finally get a concrete diagnosis from excision surgery. And that's why I chose to do what I do. That's why I talk so openly about my journey, because if there were more people talking about endometriosis when I was trying to get diagnosed, I wouldn't have had to sit on Google till 2:00 in the morning trying to figure out why I'm passing out when I get my period. So it's been really rewarding for me to try to help patients navigate the healthcare system, learn how to advocate for themselves, and learn how to cut that journey hopefully down from 10 years to maybe a couple years if we can get lucky, and teach patients how to ask the right questions and push for the right things in their healthcare. So it's been really rewarding for me to see that with patients, and hopefully, the more we have these conversations, the more we can teach patients how to advocate for themselves properly and get diagnosis quicker.
Awesome. Thank you for sharing, Taylor. And we'll go to Caley, obviously, last but not least. Oh, just a note too, Taylor is also a volunteer at Oasis FSN. She leads one of our support groups. And she's been with us for over a year now, being an advocate for infertility and an advocate for endo. So thank you for being part of our community. And I was going to say too, Leah, just to your point about finding support, like the endo events, sort of like birth story is so similar to Oasis. We went through infertility. Some of us are still going through it or involved in our organization. And we're doing it because we are trying to create the support and the resources that we wish we had when we, first got diagnosed or, went sort of through our journey. So yeah, I can totally relate to that piece of the endometriosis events charity. So well done for the work that you're doing there. Okay. Sorry, Caley, over to you.
Hi guys, I'm Caley. I'm the Director of Communications at Oasis, and as well as a host for Fertility Village Live every third Wednesday. You may have caught me last week interviewing Dr. Zenny, who is the surgeon who discovered that I have endometriosis. So that was ultimately the sort of end point of my journey. I didn't have such a long, painful journey as your other two panelists here. I kind of discovered that I might have had an issue during my fertility journey, which I was on for 3 years. I was unexplained, and everyone just kept saying to me, "You're fine. Everything looks good. We don't see a problem here." And I had quite painful periods when I was young, but I'd been on the pill for so long that it was kind of like buried, and so I never connected the dots. And then I sort of kept thinking like there's something wrong, there's something going on. There's no way that it's just unexplained and there's nothing wrong. So I really advocated to get that surgery with Dr. Zenny, and yeah, that's ultimately how I figured it all out.
Wow.
Wow. Thanks for sharing. Yeah, it's wild. And yeah, Caley too. She's one of our founding directors of our organization, has been there from the very beginning. And so thanks for all of the work and support you provide our community, Caley. And we're so excited to have all three of you here tonight. Amazing. And thanks for sharing your, just a brief intro about yourselves. Let's move on to the next question. I'm going to throw it over to Marissa.
Yes. Okay. So a question that I think a lot of people who are watching, and just a lot of people who might suspect that they have endometriosis, will probably ask, or will probably have. So for anyone watching who thinks they have endo, but maybe struggling to get doctors to listen, what advice would you give them on their journey, or what advice would you give them in terms of advocacy for themselves? Who wants to go first? How about Leah? Leah, you look like you want to go first.
Sure, no problem. So advice that I would give is most likely to realize that we know our bodies. And I think a lot of times in our society, there's such a hierarchy that exists between healthcare professionals like doctors and specialists and
Mhm.
patients. And we often put doctors on a pedestal and think that they know everything. And so we take their word for what it is. We don't necessarily ask questions. And we just assume that what they've told us is correct. And that's nothing wrong. It's just a thing that happens in our society, and that's fine. Except we have also realized through our journeys, I'm sure, that that's not always the case. And that because we do know ourselves best, as I've said, it's really important that if you're still feeling pain after being given medication, or you feel that you're being gaslit or not believed or dismissed, that you continue to push and ask questions. And if it takes a second opinion, then you get the second opinion, you get a third opinion. I just think it's important that we don't stop asking questions and seeking the help we need to feel better and to, live a healthier, more productive life in society and just in your social circles and just in general. So probably one of the things I wish someone told me, because when I was first seeing my doctor about all my symptoms, I was told, it's just a painful period and you can take Midol. And nothing over the counter was working, but I still just assumed this is what periods are supposed to be like. And I wish that I kind of, pushed a little bit further and just asked more questions. I know it's not
Yeah.
always easy, but, it's just something to think about.
How are you
And I'll
supposed
just
to
jump
know?
on to what Leah is saying. Like, I was told when I was diagnosed, it's not normal to have a painful period. And that's something that we are not taught in school at all. Like, people just think it's completely normal and yeah, just take a Midol or whatever. It's not normal. So if you're having really painful periods, go talk to a doctor.
Yeah, that was going to be my statement, Caley. Like, you took the words right out of my mouth. This is what I tell every single person that I talk to. Your period should not interfere with you doing daily life. You should not be in so much pain that you can't go to work, you can't leave your bed, you can't do your activities of daily living. If that happens, that is not normal. Something else is going on. So I agree. I think that we're taught in high school and in elementary school, unfortunately, for some girls, depending, like, we're seeing girls get their periods so much earlier. And the more research that's done, we see that we're probably experiencing symptoms of endometriosis prior to menstruation. It's not just exclusively a menstruation disease. So we're starting to see that, maybe you've had recurrent UTIs as a child. Maybe you've had other things going on that could also be playing a part in potential endo down the road. So it's not that simple. And like Leah said, your body, like, follow your intuition. Your gut is normally right. I feel like I knew I had endo from the minute I read what it was. I read it and was like, okay, well, that's a textbook description of what I'm dealing with. And I feel like a lot of people are like, that's exactly how they feel. So yeah, I couldn't have said that better.
We have an incoming question for anybody who wants to answer. Do you guys know about endometriosis mapping ultrasound, and have any of you guys ever had it done? I've heard it's a new way to get a diagnosis. Oh, Taylor? Hello. Please
I
answer.
had endometriosis mapping done.
Okay.
I think that there's a long way to go with diagnosing via ultrasound. I don't feel it's like a great gold standard in Ontario right now, to be honest. I don't think we have a lot of people here trained. There are some phenomenal programs in Australia that are training phenomenal surgeons to, perform these ultrasounds. And that's amazing. I had ultrasound mapping done a few years ago prior to being referred to my new specialist, and was told I had no signs of infiltrating endometriosis. Not even a year later, I had an MRI that showed significant endometriosis in both middle and posterior compartments. So that's like everything pelvic, uterus, bowels, ovaries, like my ligaments. It was a mess. And I was told there is absolutely no sign and that my pain was likely mental, which was after the post endometriosis diagnosis.
Wow.
So I'm not a fan. I have also heard people have had phenomenal success with endometriosis mapping. I do feel that there are some people successfully doing this in Ontario, but it's really limited. And you would probably find more experienced specialists elsewhere who have maybe done it longer. But there's still a long way to go, I think, for endometriosis diagnosis through ultrasound, personally.
Wow, that's so interesting. Yeah, because last week, Dr. Zenny, who is one of the guys who was trained in Australia, who does the mapping, he's saying it's the future, which I think it's just it's more not as invasive as, a laparoscopy. We had to go in and like look around, but yeah.
And he's incredibly experienced. Like right. If I had to suggest somebody, everything I've heard would be sending them to Dr. Zen.
Shameless plug for last week. If you didn't watch that episode, go back, because it's he talks for an hour, and I was just like, whoa, he was myth busting all over the map. It was amazing.
And he talked all about the mapping as well.
He did.
Mm-hmm. Yeah. I've heard great things, and I've heard all the success stories I've heard are Dr. Zenny patients, people who have gone in and knew that they had endometriosis and were positive they knew where, and he mapped that endo for them. So yeah, if you have to say it, that's somebody I know from patient experience that's had a great experience.
Can you all speak to when you finally did get your diagnosis? What was that moment like for you? Was it like frustrating? Like, I'm not going to put emotions in your mouth, but we'd love to hear, like, what did that feel like?
I can speak to that. I went into the surgery convinced in my heart that he would find something, and weirdly, and this is such a backwards way of thinking, but I wanted so badly for something to be wrong with me, because I had spent so long being told everything's fine, you just can't get pregnant. And I went in just like begging for someone to find something. So I was actually thrilled when I got my diagnosis. I came out of surgery and it's like, we found all this endo and you have a septate uterus. And I was like, yes.
Wow. Hallelujah. I could see how that would be a relief. It's like, we finally have an answer for this unexplained issue.
And can you imagine going through surgery and then you come out and they're like, yeah, you're fine. That would be way worse.
Yeah, totally. Anybody else?
Yeah, I was just going to say, I echo exactly what you just said, because for me, I would say my diagnosis was bittersweet. So in a sense, I was happy to know that there was actually something wrong with me and that it wasn't all in my head all of these years. And so it felt a bit, it was validating, because I knew something was wrong. I didn't know what it was, but I knew something was wrong. So to get the diagnosis definitely was something that I was grateful for. And because it then was able to, allow me to explore different modalities of healthcare and different ways that I could treat myself and feel better. But at the same time, it was also challenging to hear that, because we know there's no cure for endometriosis and we know that it's a long journey. So I kind of say my journey is divided into two parts. So like pre-diagnosis, where I was experiencing not knowing what was going on with my body, and then like post-diagnosis, where I'm still obviously exploring different things that can help me and still obviously not cured and dealing with pain. So it's bittersweet for sure.
Yeah, I like the term bittersweet. Like, I think that that's the perfect way to explain it. When I got diagnosed, I had taken so long to like research what was going on with me, that at that point, I was pretty positive I knew exactly where my endo was. And my specialist, Dr. Leyland, who's no longer practicing, but he was at McMaster, who like gave me my life back. He was amazing, and he advocated for me a lot and did like a lot of really amazing things for me. The way he delivered the news was really empathetic and really like reaffirming, because you are gaslit like up until that point to believe that everything you're feeling is either normal or in your head. So he sat down with me and he said, so where did you think your endo was? And I listed off, and there was the only thing that surprised us was how extensive the bowel endometriosis was. I had a bowel resection during my first excision, and it was quite extensive, but everywhere else, it was like so validating to have him ask me what I thought the problem was. And then for him to be like, not only were you right, you weren't right enough. Like it was actually worse than you thought it was. And he had mentioned that during the surgery, they actually brought oncology students in to explain, like, this is why endo is like cancer. And he was like, you know, you guys are told forever that it's nothing. And he's like, it was something, like really something. And that was so reaffirming. But it's also so frustrating because you knew all this time. I went through like 6 years of infertility prior to that. And like severe pain and like missing out on things with my son and my family. So that's really hard. But yeah, like Leah, bittersweet is like, that's the perfect word for it.
Yeah. Validating, but upsetting at the same time, for sure. Okay. Let's ask a different but same kind of question. I know some of you have already touched on this, but we know that there's tons of treatments that are out there. Some are better than others, some work differently, and we know treatment is not a one size fits all. So what different treatments or surgery have you tried, and what's worked or maybe not worked so well for you guys? Caley, you want to go first? Because you're unmuted.
Sure. Where did I? So I had a sneaking suspicion I had endo. So I did this test called Receptiva DX, which is where they do a biopsy, I think it's a biopsy of your endometrium. They like take out some cells. It's quite painful. Anyways, so that came back positive. So I was convinced I had it. So my fertility doctor put me on this drug called Lupron Depot. Wouldn't recommend it. It brought me to my knees. I'm not even exaggerating. I was hiking and I felt my bones were in pain. Like it was one of the worst drugs I've ever dealt with in my fertility journey. It was awful. And I did a transfer after that, no luck. So that was the first treatment I dealt with. And I continued to be convinced I had endo. So after that, I pushed really, really hard to go get the surgery. And ultimately I had excision surgery, and that's the last thing I did.
So that's what worked for you.
That's what worked for me. Yeah.
Okay. Thank you for sharing. Leah, you want to go next?
Sure. So I also had laparoscopic excision surgery. I've also tried different treatment methods, just because surgery is one thing that for some people, but not for everybody. But my doctor had also put me on Vizan at one point. So I tried hormonal medications, and I also was on the birth control pill at one point. I've tried pelvic floor physiotherapy, and that's been something that I find quite helpful. Even prior to my surgery, my surgeon and my pelvic floor physiotherapist or pelvic health physiotherapist worked together to see what could work for me to prepare my body for the surgery, and then as well what could help post-surgery. So I felt that was amazing that they worked together and were able to help me in that way. And then I'd also always tell people to explore anything that has to do with your mental health, because endo doesn't just affect you physically, it does affect you mentally as well. So if you can see a counselor, a therapist, anybody who you can actually have a conversation with and talk a little bit about the feelings that you're experiencing, because it is a very difficult disease to deal with. And sometimes it's not necessarily conversations that you're comfortable having with somebody at work, like a boss or anything like that. So it's nice to have somebody else with whom you can have these conversations and be open and cry and laugh or do whatever you need to get through. So that's something I advocate for as well.
For sure. Actually, thank you for mentioning that, because I think we're talking about endometriosis and we're focusing heavily on the endo, but it's so easy to kind of not remember to talk about the mental health aspect of it, and just in terms of like fertility in general, how tough it is mentally, right? And this is why Oasis does what it does. This is why Oasis is here. So it's all for mental health support and community, and making sure that you have somebody during the rough days. And that's so important during these journeys. One question for you, Leah, how was your recovery for your laparoscopy surgery?
So my recovery was a little bit difficult. So my surgery did last 9.5 hours, the first surgery that I had. So I've had 3, and it was a very lengthy surgery because I did get diagnosed with stage 4 endometriosis. It was very expensive and on many organs. As we know, it's a whole body disease. So there was a lot that had to be done. Recovery, I stayed in hospital for about 5 days, and I did have to have 2 blood transfusions. So it was a difficult time for me for sure. But somebody had told me ahead to make sure I took those walks when the nurses came around and asked you to walk the floor and chew some gum when the air is escaping after you've done the surgery itself. So there were a few tips that I think were helpful. And I don't tell people these things to scare them. It's just the reality of how extensive and how difficult this disease is for a lot of people. And for people for years, just kind of dismiss this pain, it makes it, really real when you're actually on the table and when you're recovering. But the surgery definitely did help. And I felt better afterwards. I just needed a little touch up, I say, afterwards. So it did help me for sure.
All right. Thank you for sharing. Taylor, what kind of treatments did you have? Did you have surgery? I think you touched on this, but can you?
Yeah, I've done all the things. My theory going into endometriosis treatment was if I say yes to everything they suggest, then they won't say no when I ask for surgery. Because advocating for surgery is not always easy, as we know. So I started with the pill when I got my period. That was what they put everybody on for painful periods. I have a migraine disorder, so that was really difficult to find the right medication. I did Depo-Provera, which is like the worst time ever. Would not suggest. Worst thing for my mental health I think I've ever done. The reason why I focus on mental health with endo is because once I started really getting into endo treatments, I was probably like in the worst bouts of depression I've ever experienced. The chronic pain was so bad, and I was like I was living at probably a 9 or a 10 pretty regularly, like 28 days out of the month. So I was non-functioning, but I was a parent and I had to function. I worked 2 full-time jobs. Like I was working like 60 plus hours a week. So I'm the opposite of Caley, which shows you just how different people's bodies are. Lupron probably saved my life, which is a very controversial thing to say in the endo community. But Lupron literally took all of my pain away. And the only side effect I had was decreased bone density and hot flashes. And I was able to get my bone density back to where it was supposed to be. I did Zoladex as well, which is an Australian medication similar to Lupron, but is pretty invasive. Like you do have to get a local anesthetic before you get it in. It like inserts a little capsule, I think, under your skin that gives medication. It's not a very common med. It worked well. It's very similar to Lupron. I think that's how it works. Then ultimately I ended up having excision surgery in 2017. And then I'm now 6 months post-op from my second excision surgery, full hysterectomy, and like reconstructive pelvic surgery. So, I mean, I'm the advocate that, like, for the most part, surgery is the gold standard, and really people find a lot of relief from that. It doesn't cure you, but it definitely gives you like some long-term relief. But yeah, I've had 2 excision surgeries, which ultimately were like the great thing for me.
Okay. All right. So thank you for sharing. So it sounds like all of us has had all of our guests have had some kind of surgery. Give us advice for anybody who's preparing for an endo surgery. So I know, Leah, you were giving some tips like chewing gum for the gas to escape after laparoscopy. But I know you guys have more tips. I can feel it since you've been through so much. So give us more tips for the people that want to know, who are maybe prepping or going for another one and didn't have a good experience the first time around and just want a little bit of a better experience the second time around. Give us the tea, please.
Get comfy pajamas.
Okay.
I lived in really comfy pajamas for like 2 weeks after.
Okay.
I didn't want to put anything around that area of my stomach and pelvis. Like, I just want something really loose and comfy.
Okay.
And I just sort of like had a bunch of, sorry?
How do we feel about diapers?
I didn't need anything like that.
Oh, okay. Oh, yeah.
Yeah.
Taylor saying
Okay.
yes.
Fair.
Well, I mean, with the different surgeries, I know there's like laparoscopies, so that's like pinhole surgery, right? Essentially.
Yeah.
But then is there ever like full open? Like, I'm sure there's different recovery times for those things. So in your experience, Caley, what was the recovery time for your surgery?
Yeah, I just had the laparoscopy. So I just had the like they were like tiny little incisions. I think there were 4 and then one in my belly button. It was a little uncomfy to be getting up from like a seated position and things like that, but I didn't find it that brutal, guys, honestly. And it's a lot less brutal than going through life with really, really horrible, painful periods and other symptoms like infertility. It's so worth it. I'd say like I was off work for 2 weeks. I was like, the first few days were really uncomfortable, and I had a bad reaction to the general anesthesia and then a bad reaction to the pain meds. So, you know, if you didn't have those reactions, it wasn't so bad.
For sure, short-term pain for long-term gain kind of thing.
100%.
Okay, more tips. Give us more tips, more that we want to know. Taylor loves diapers. Good, so do I.
Yeah. Honestly, get rid of your pride. Like, it's the same as having a baby. Get rid of your pride. Be okay with bleeding and having a hard time having bowel movements and needing help to lower down to the toilet. Like, be ready to ask for help, because I think when you are a patient with endo who is used to operating at a high level of chronic pain all the time, you don't ask for help because you feel like a burden constantly. So you very, very quickly adapt to living life on your own and not asking for help from people because it just needs to get done. And when you have surgery, like, I agree with Caley, I didn't find recovery that bad. I work in the operating room, so I had to be off for 12 weeks. I can't go back to my job. But prior to that, I have like had ovarian cysts removed and gone back like 2 weeks later to work. You hit the nail on the head. Like, it's way better to deal with that short-term pain than it is to deal with chronic long-term pain at like a high level. My suggestion is, don't have any pride going into it. Be okay to ask for help. Buy a good heating pad. We, as endo warriors, like, we love our heating pads. It's a very intimate relationship. I don't go anywhere without it. So have it with you. And queue up some good movies on Netflix. Give yourself a distraction and just don't do anything. Be okay with not being the person everybody relies on for all the things. Just focus on you for a little bit.
Yeah.
That's so good.
Then once you recover, you can be that person again. Well, that's great. Yeah. Leah, you got some tips?
Yeah, I was just going to add something. I'm going to add something else to that.
Yeah.
So One of the things I think a lot of us don't do is give ourselves grace. So once that recovery is happening with you, you need to make sure you remember your journey is your journey. Not everyone's recovery time is going to be exactly the same. Some people may feel better quicker. Some people might have a longer time to recover and return to work. So just remember that your journey is individual to you, and depending what happened, what stage of endo you have, who was in the operating room, there are so many factors. So just be patient with yourself, be kind to yourself, and let yourself heal the way your body needs to.
Okay.
I love that.
Thank you. Yeah.
Thank you for sharing.
So good. Okay, we're going to move on and have a whole section. We're going to talk next about managing life with endometriosis. So we know that endo doesn't just affect your reproductive system, it affects your whole entire life. So you can speak to how it impacts your daily routine, work, relationships. I mean, we've talked about those things, the mental health a little bit. So were there any lifestyle changes that you've made to help cope with the endo, and how does it impact your daily routine? Who wants to go first?
I'm gonna let you guys take this one. I feel like you both were quite affected by it in terms of chronic long-term pain, and I was on the pill for so long that it was kind of buried for me.
So unlike Taylor, Taylor, were you going to say something? Or? Okay. So unlike Taylor, when I got my diagnosis, I actually did not know what endometriosis was at all. So I had never heard the word until the doctor told me I have endometriosis. And so that was like, something in itself that was difficult for me. So I started my Dr. Google research stuff way later on. So I wasn't doing any of that proactively. I was just kind of like, okay, now I have endometriosis. What exactly is this? What can I do to help myself? So luckily I did also have a surgeon who was an advocate, for pelvic floor physiotherapy, as I mentioned before. So endometriosis did affect me because when I had my surgery, I had to take time off work. I did take a little bit more time just because I am an elementary school teacher, and it's a little bit of a difficult job when you're on your feet all the time, dealing with a lot of the issues and trying to teach and just get through the day. So I did take some time off to deal with that. And also I just feel that trying to do different things like an anti-inflammatory diet is something I tried, and that didn't necessarily work as well for me. I did find, the medications that I was on post-surgery were effective, but I do find having conversations with people in your life who could be your support system were also very helpful, because it did affect me in all aspects. Like social life, I missed out on so much of my youth, travel, doing extra things that I wanted to do, just even having to take time off work and school. And I know a lot of the things I suggest as well can't be accessible to everybody because it does cost money. And so that's why we also have to remember when we say our journey is our own, that it depends on what you can afford, what you're comfortable with, what works for your lifestyle. So if you have extended healthcare benefits, that's great. If you don't, there are options out there. Like I know there are foundations where you can get grants and different things, but yeah, there's a lot that you can try, but again, not a one size fits all at all, for sure.
For sure.
Yeah, no doubt. Who wants to jump in next?
I can go. I echo that. Even though I was proactive in researching, the only reason I think I jumped to that first was how severe my periods were, right off the bat. Passing out the first time I had my period, to me, did not feel normal. So I have a real hot girl list of stuff going on in my body. I have endo, adenomyosis, PCOS, and then just recently was diagnosed with celiac disease and Hashimoto's, which is so fun.
My goodness.
So we just have a really fun list of autoimmune disaster going on. But the tricky thing about that was a lot of this stuff I've had my whole life and has been disguised as other things. So growing up, I had a migraine disorder, which once I got diagnosed with celiac disease, my specialist said was likely undiagnosed celiac disease my entire life.
Oh
Which
no.
probably didn't help the inflammation with endo as well, because I'm like inflamed from an autoimmune disorder. And then I'm assuming that's probably why my endo just like really went hard right from the beginning. So like everything I was experiencing, I just chalked up to, I had been diagnosed with IBS, which a lot of endo warriors I'm sure can relate to. That's the usual umbrella diagnosis that's thrown out to everybody. You have IBS and anxiety. Best wishes. So a lot of my symptoms were actually like bowel and bladder related, which is why I didn't think about endo right off the bat. Then slowly started realizing that these things, I basically started tracking my periods and then realized that a lot of the stuff I was experiencing was cyclical at first. Eventually it turned into being all the time, but at first it was cyclical. So I would get flare-ups of my IBS when I got my period. And then I would have nausea when I had my period. And then I'd have right-sided back and leg pain when I got my period. Then I started getting drop foot. So I was like losing control of my leg because I had endo on some ligaments and a nerve. So it's just, there's all these things that we don't even think of. So people just say endo, they say it's a reproductive disease. And you think, okay, well, if I don't have pain during my periods, I probably don't have endo. There's so much else that can go on. And it affected my life in every aspect. I was losing friends because I was bailing on going out places, because if I even touched food, I was in the bathroom 5 seconds later. So I couldn't go out to dinners and I couldn't go to events. I'm the friend that's always sick, which is like the worst thing to be known as. And so people just stop inviting you to things because you're always sick and you're not fun. And it took a lot of like getting out of my shell. I was pretty quiet about what was going on at first. And then I really started talking about it because I was like, there's no other option. Like, I feel like, yeah, I feel stuck, and I feel like there was no way to fix the relationships unless I was open about it. And that really changed everything for me, but it affected everything. It affected work. It affected friendships. It affected my marriage. It affected all of my relationships until I started talking about it more.
Well, thank you for sharing. I know you're being very vulnerable and very giving us a very deep insight into like how your life was. And a lot of people don't share that because it is difficult to share that kind of stuff and to be honest about that. So thank you very, very much. We have a viewer question. Were there any symptoms that you were experiencing that you had no idea were related to your endo? And then afterwards you found out this is endo. I just didn't know that they were related.
I mean, for me, just super painful periods. But when I was a teenager, before I went on the pill, I was like calling out of work and getting fired and stuff like that from my like Tim Hortons job, you know? Yeah, but it sounds like, Taylor, you had some very interesting related symptoms, like that you mentioned drop foot. I've never heard of that.
Yeah, so I had a lot of endo surrounding a nerve kind of near my sciatic nerve. So a lot of this stuff recently, so I'm, like I said, I'm 6 months post-op, but my most recent symptoms were like pretty severe back pain, cyclical back pain, and it was like not normal. I've had sciatica. I used to be a competitive, like I used to do competitive sports. I'm active. I do yoga. I do a lot of different things. I've had back pain. This was not normal back pain. And it initially started a couple days before my period and then slowly came more and more. So like it all of a sudden started coming like a week before and then 2 weeks before. And it would get to the point where like I'm working in the OR, like with a portable heating pad on, sitting down, helping with surgery because like I can't stand up because my leg's numb. So I was really confused. I thought I had like herniated a disc or something like that. Also, like a lot of my symptoms were like bowel related. So flipping between constipation and diarrhea, which is why people thought it was IBS. That was probably the most impactful symptom for me that I didn't realize was endo. And then a lot of bladder related things. So symptoms of UTIs with blood in the urine, but no positive UTI. So that was the biggest one for me, like repetitive burning when I peed, urgency when I had to pee, and like pain. And then I would go and get tested for a UTI and I'd be negative, but I always had blood in my urine. And it was because I had endo in my ureters. So I'm assuming when I was peeing, I was peeing like red blood cells. So those things, like I never, when you research endo, and when I was researching endo, 14 years ago, it was like a reproductive disease. So it was all period related, and I didn't realize that's what it was until I started actually reading like journals and stuff of people looking at endo in different parts of the body, and then I was like, this actually might be what's going on. But there's some weird symptoms out there that you do not realize are at all related.
Yeah, it sounds like it, because like, how do you know what's just life and what's endo if endo can be everything, right? It can affect everything. Yeah, thanks for answering. Okay, we got one more viewer question. So the question is, after my laparoscopic surgery, my symptoms were much worse. I asked the OB that did the surgery, and she said that this was completely normal. Did anyone else experience this? I've since learned that surgery should be done by a specialist. Has anyone else experienced worse endo pain after the laparoscopic surgery?
I did not, but that does sound like it should be reviewed by a specialist.
Yeah, I also did not experience worse pain. So I would definitely get a second opinion on that and get that reviewed. And I also was just going to say that I do have to log off, unfortunately. But I did want to just say one more thing to people who are listening out there. Before you go into any type of surgery, it's important to have those conversations about what your goals are and what's important in your life. And since we're talking about fertility, I just wanted to share that my journey took me on the fertility path, where I decided to freeze my eggs as a preventative measure prior to going into surgery, just because there was a chance I could have a hysterectomy. So because it was important to me to, grow a family and explore that, I decided to look at that as an option. So I did see a fertility specialist, and I think that's something that people don't often do. So I think that's something I just wanted to share before I log off, as well as I'm happy to answer any other questions in the future. You're welcome to follow us on socials at Endo Events, or email us at endometriosisevents@gmail.com. And I just wanted to say again, thank you for the opportunity. And I'm so sorry that I have to go, but I did enjoy the conversation. I learned a lot as well, which is great.
Thank you for being here, Leah. We really, really appreciate your time, and you've added so much to this conversation. So thank you.
Thank you as well. Take care.
Thanks,
Bye,
Leah.
everyone.
Thank
Bye.
you.
Thank
And
you.
we'll link everything to Endo Events in all of the afterthoughts when this goes live, it is live, when it goes out to the universe for forever, to the webcasting, all the places. Oh my gosh, you guys, I swear I have 4 brain cells right now. I said this before. You can't trust anything I say right now. So it's all good. Leah, thank you so much. And we can't wait to have you back another time. Okay.
For sure. Sounds good. Take care. Good night.
The eggs. Yes, later.
Thank you. Take care.
Take care.
Bye.
Amazing. I think with that, we'll move into some conversation about endometriosis and fertility. So let's talk about that. How has endo impacted your fertility journey, ladies?
Oh my gosh, so much for me. It was,
yes.
I mean, I have to assume one of the big reasons behind my unexplained infertility that I was dealing with for quite a long time. I went through 3 egg retrievals, 3 embryo transfers, 2 of which just failed. I did end up having a septate uterus as well as the endo that was found. So it was all a big old issue in there that got hopefully somewhat solved. But yeah, it had a huge impact on my fertility.
But the good news is, like, after all of that, you were able to have success and have a healthy pregnancy and go on. So that is, I think, really hopeful for folks who are out there and like, I have endo. I wonder if I'll ever become a mom, because that is like the most scary thought you'll ever have if you've always heard of that. And so it's a happy, hopeful story. Shameless plug for the podcast again. Caley's coming on in a couple months. She's going to share her story. So watch later this season on the Erin and Tiffany episodes of Fertility Stories. Caley's going to tell her whole story. So you're going to get it all there. So join us later this year for that over there on Spotify. Okay, Taylor, why don't you stop talking?
Oh, that's good. Yeah, I didn't realize how much endo impacted my fertility because I was pretty naive when it came to fertility. I was told pretty early on I couldn't have kids. So I had like really grieved that quite early. Once I had like been dealing with all my period stuff in high school, I had an ultrasound, and then it was suggested that I had a sonohystogram. They were trying to figure out what was going on. Sonohistograms are usually only done like diagnostically for endo or diagnostically for fertility. It was found that I had, or the thought was that I had bilateral tube blockage. So that if I wanted to have kids, it would likely be IVF down the road. I didn't really see that being a thing for me. I thought, if I'm going to have kids, I'll adopt. I didn't know how I felt about IVF at the time. I was young. I was like 18 years old, 17 years old. That wasn't even on my radar. Turns out it was. I ended up getting pregnant at 19, very unexpectedly on birth control, which was like very confusing for me as somebody who was told I had fertility issues. And then I actually dealt with secondary infertility for 6 years. So our second baby, who we, were planning to have, we tried and tried and tried. And I didn't really know what was out there for fertility. There weren't really very many resources back then. It was like 2014. And unless you were referred by a doctor kind of like past 35, it wasn't really something that was openly talked about a whole lot. At least in my circles and where I was from. So I didn't have a lot of support. I would have loved to have something like Oasis back then. That would have been amazing. I ended up doing some timed intercourse cycles and a suggested IUI, which we never ended up doing because I got really frustrated and we gave up. And then I ended up getting pregnant, I'm assuming probably just before we gave up in frustration on a timed intercourse cycle. But I also have PCOS and adeno. So I had a bunch of things playing against me, which is probably why it took me 6 years. And had I done active cycle monitoring properly, if I knew then what I know now, it probably would have been hopefully a lot less time. But yeah, it was a long time and a lot of wish I hadn't known. So it's great to have these conversations so that people who maybe don't know how to ask those questions and don't know where to go can ask.
Yeah, for sure. Okay. Let's move on to our next one. And I think this is really important. If you could just give us one piece of advice for someone with endo who is just starting their fertility journey, what advice would you give them?
If you haven't had excision surgery, I would say get yourself on a list because the wait time is insanely long and just getting longer and longer. So even if you're not sure you want it or not sure you need it, because a fertility doctor might tell you that, that's what I was told, that do the surgery for your quality of life. Don't do it for fertility because there's no definitive thing saying it will help with the fertility. I'm so happy that I did do it. And I really did do it for the fertility thing. But anyway, just get yourself on a list so that if you do end up wanting it, that you have that option and you're not waiting for years and years. And there's unfortunately a bit of a clock on fertility. So
I've heard the wait lists are long. And like Dr. Zenny last week was saying that I think he said like 12 to 18 months to get surgery with him, to get in for surgery.
Not that bad.
He said, Yeah, he said 6 months to get a consultation with him, followed by, I think it was 12 to 18 to actually get the surgery after that.
Yeah.
Yeah, so
Yeah.
it's not that bad. That's actually pretty, that's on the tamer side for some people. Like that is amazing given his reputation. That's so awesome. Yeah, mine would be really similar. Like surgery gives a lot of people their lives back. My only suggestion to every single person who is even remotely interested in surgery is please see an excision specialist for your surgery. There is a right and wrong way to remove endo, and it matters. It matters for reoccurrence. It matters for symptoms post-op. It matters for severity of symptoms post-op. And that's not to say that gynecologists and OBs who have done endo in the past are not capable. It is, people are trained for a reason. It matters. So that's something that's just like so important to me is make sure you're seeing a specialist who is trained in removing endo properly.
All right.
Thank you. Such great advice from both of you, from all of you tonight. We're going to ask one last question, and then I think we're going to have to wrap it up. This has been an awesome conversation. This hour has just flown by. I can't believe
time gone.
Yeah, it's bananas. Okay, so last question, and I feel like I've learned so much tonight. I mean, Tiffy said on Instagram too. I've learned so much over the last few episodes about endo. So happy if you're listening tonight. Go back, listen to the other episodes. So educational. But like I mentioned last week, we were myth busting with Dr. Zenny. Let's talk about some myths and misconceptions about endo. Is there what are the most frustrating ones you've heard? What are the things that you're like, oh gosh, if somebody says that one more time, I'm going to snap. Give us the frustrating
Taylor's ready.
misconceptions.
This is my nightmare question. This is my nightmare.
Okay, well, you have 2 minutes. I mean, we can go over 9, but we like to keep it short for Spotify so people don't tune us out.
My biggest one is that endometriosis is caused by like retro bleeding. So this was like a big thought years and years ago, is that the cause for endometriosis is that you're like bleeding back into your pelvis. And that was like a whole, it's a big thing to go into in 2 minutes. Look into it. It's a whole thing. But this was like peddled as a reason for endo for a really long time, which has since been myth busted. But this was like a lot of misinformation, or that endo is like specifically a reproductive disorder, only found in the pelvis, only found in reproductive organs. At this point in research, we have found endo in every single organ in the body. Before it was everywhere but the spleen. Wow. In the last year, that's changed. Every single organ. There has been endo found everywhere. Ducts of your eyes, your nose, your brain. It's insane. So that's the biggest thing for me. It's not just a reproductive disorder. It is a whole body disease.
Yeah.
Wow. In your nose.
I know. Wow. People having cyclical nosebleeds or bleeding from their eyes during their period is a real life thing that happens to women.
I mean, that is so good for the younger generation. Just thinking about like, like you said, UTIs reoccurring, bloody noses, like these could all be early symptoms of endo for if you're watching out there and you've got,
Wouldn't it be nice to have this education in high school?
Yes.
Yeah.
So that we know what this is. Like, I don't even know what we would call it, but like 101 on your body.
Women's health. Fuck, women's health. That's what
it's Jeez.
Oh my gosh. Yes, 100%. We'll get Leah on that. Leah and her advocacy work. We'll get her going on the school education.
Taylor, you should go to the high schools and be like, if you're bleeding from your eyes and your nose during your period, it could be endo.
I would love to get an endometriosis program in high school. Real talk.
Yes.
If anybody has resources out there to get that started, it's something I've actively looked into. I have done education in high school for sexual health. I would love to do that. It needs to happen. It needs to be a thing.
Let's get Leah on it. Absolutely. All right, Caley, your myths and misconceptions. Let's go, and then we're going to wrap it.
Okay, it's not even a myth or a misconception. It's more of my bone to pick. is just that the research is not there. And I think it's because it's a women's health issue. In fact, I've had doctors say that to me. There were so many questions I had during consultations that people were like, we don't know why that's happening. We have no idea. We don't, like, basic stuff that they should be able to answer.
Had endometriosis.
Yeah.
Oh, Mendometriosis is an actual ad campaign I've suggested at my agency that I work for. I was like, we need to have an awareness campaign called Mendometriosis.
I love it. Oh my gosh.
Men are suffering.
Yeah. It's crazy. It truly is. And yeah, thank you both for sharing. Wow. So many amazing highlights and so much support for folks who are going through this and who are on the journey to get diagnosed. So thank you. Thank you so much.
Yeah, this has been such an insightful conversation. I've learned so much. I feel like this was like a one-on-one or a 101 on endometriosis.
Yes.
So thank you guys for sharing your experience, your wisdom. Leah that left as well. If you're watching, thank you so much. Erin, you want to plug in some more stuff before we go?
I love plugging all the things. Yeah, thank you everybody for watching. You know you're not alone. We are here for you at Oasis. So please join the conversation every week, Wednesday nights at 8 o'clock. We have a very exciting April coming up. We are talking about stress and mental health. We have a hypnotist coming on. He talks about hypnosis for fertility. He's not going to like actually hypnotize me. It's not that same kind of thing, but still, it's going to be so good. We have therapists. We have my Storia coming on, talk about advocacy. Hi, Jess. I see you watching. So absolutely come on out. It's going to be an amazing, amazing month next month on the Fertility Village. So get here every week on YouTube, on Facebook, and on our Oasis FSN Instagram. Thanks all for joining. We're going to head out. Thanks, Taylor. Thanks, Caley. Thanks, Marissa, for being
Thanks
here.
for having us.
Thanks, guys. Thanks for having
Take
me.
care, everybody. See you